challenging adapting to new research and new ways of communicating. It can sometimes be very hard to kind of communicate empathy and kindness through a mask.
So I've not been able to see my niece, my nephews, just people that are very dear to me. That's been the hardest. Not being able to give people hugs, and anyone that works with me knows I'm a hugger. That's been the hardest.
At the start of COVID, I was redeployed into the occupational health service, and one of the biggest challenges that I faced was writing a risk assessment for staff who have underlying health conditions and also staff who are more vulnerable to the COVID.
So many to talk about, but really trying to stay kind to myself and to other people when things were getting really tough. I think that's a really important lesson to focus on.
The way we came together as a team and then very quickly and learn about this pandemic and learn about COVID-19 itself, and then develop pathways and then put those into practice. That's actually quite inspirational because that's quite a lot of work.
It's the way we've come together as a working unit. I know we worked well beforehand, even before COVID, but the way the NHS and all other organisations, different companies have all come together and started working as a big family, almost to say, that's been inspiring.
Seeing everyone's efforts to keep each other happy and keep each other's spirits up really did inspire me. It was also incredible having the volunteers deliver us food because it definitely kept our spirits up.
I think the first or second time I heard the clap for heroes, I was out walking the dog in the middle of Hyde Park, and it was just amazing that the noise of all these people saying thank you penetrated all the way into the middle of the park. It was a great moment.
The government, to support the NHS, we need to give the nursing bursary back. We need to make nursing and midwifery a much more attractive profession to join. So we've got to create a positive practice environment. So that's education, the bursary, and making nursing a profession which people going to join. I think the government, we need recognition as well. We got so much recognition during the COVID period. We need to keep that going.
Subsidizing transportation or fares for people who are traveling from long distances.
Maybe considering providing meals for NHS workers. The fact that we've had free travel, more to prevent people from catching COVID, that's made a massive impact in terms of travel costs and so forth as well.
The government needs to invest to save. The NHS has been making efficiency cuts for years, and it cannot get any much more efficient. Spend money to get more value.
The NHS is incredible for doing what it does on the money and the resources it has. Imagine what it can do if it had the right money, the right resources and protection from privatisation.